today's World Insight, efforts to keep the coronavirus spread in check. The latest from the World Health Organization wrapped to China.
Without the measures that have been taken, both locally as well as nationally, we would have seen a much larger spread.
And the U.S. State of the Union address signed, sealed, and delivered. The takeaways from Mr. Trump's speech. Here's our host, Tian Wei.
Hello and welcome to World Insight, coming to you live from Beijing. I'm Tian Wei. Let's begin with the coronavirus outbreak in China. The death toll now stands at 493, mostly in Hubei province, ground zero of the epidemic. The nation's total number of confirmed cases is over 24,000, with more than half in Hubei. On Wednesday, nearly 4,000 new cases have been confirmed across the country, while about 1,000 people have recovered nationwide. Beyond China's border, the virus has spread to 24 other countries with a total of 193 confirmed cases. The World Health Organization plans to send a team of experts to China as early as this week, according to the latest report, to help halt the spread of infection. Earlier, I talked to Dr. Gordon Gallia, the WHO representative to China, days after he came back to Beijing from Wuhan. Let's take a listen as to what he had to say. And for more on the outbreak of the coronavirus, we are joined by Dr. Gordon Gallia, or Gao Li, his Chinese name is, who is the WHO representative to China. Dr. Gallia, welcome to our program.
Thank you, Tian Wei.
Thank you so much for sharing your time. I know you have a very hectic schedule these days. Tell me more about the latest assessment of WHO of the outbreak of coronavirus right now as we speak, sir.
It has been declared a public health emergency, which means that all countries need to get ready for it. At the same time, the mortality rate has settled to around 2% of known cases, and that is a far lower number than it appeared at the beginning.
What do you make of the latest situation and even mistreatment of Chinese and people who wear face masks elsewhere in the world? We've seen increasing numbers of stories like these recently.
Every country has its sovereign right to make its own public health risk assessment and to decide what actions it will take to protect its citizens. WHO did not make any travel or trade restrictions based on the evidence that is available, because it understands that there are ways in which countries can protect themselves through increased surveillance, through increased laboratory and clinical readiness, through appropriate risk communication with their populations. So the balance has to be reached between the overall costs to the global society, global economies, and the public health risk. Hopefully, over a short period of time, a balance will be reached that is reasonable and minimizes the cost.
Has WHO, on the other hand, Dr. Gallia, providing advice to those countries what WHO consider as overreactions, or already reacting in a way as if it were a global pandemic? Because WHO already said it very clearly, it is not yet a global pandemic.
Under the international health regulations, WHO is empowered under Article 43 to receive from the countries concerned their public health rationale. It will be assessed by WHO, and communications will go back to the countries concerned through, again, the internal peer review that is offered by the international health regulation. WHO does not have the power to judge or to decide on an individual country, but it can point out what are the alternatives that there are, and it can provide an assessment to those countries on the appropriateness of the public health rationale. This is well within the agreed international health regulations.
I see.
And that is a process that is already ongoing within WHO.
With what countries can we share here?
Of course not. This is the international health regulation is a peer review within the process within the network of international health regulation focal points.
Dr. Galia, apart from the WHO's assessment of the latest situation of the outbreak, he also explained to me in detail in that exclusive interview about the timeline, the efforts made by the medical staff, and also the locals in Wuhan, the epicenter of the outbreak, as well as the significance of global cooperation on combating the spread of the coronavirus this time. We're going to bring to you later in our program about that part of the interview. But for now, still to come on the World Insight today. The U.S. State of the Union address signed, sealed, and delivered. The takeaways from Mr. Trump's speech right after the break and all the dramas. The U.S. President Donald Trump has delivered his third State of the Union address. On Tuesday night, his speech took place less than a day before the Senate is set to vote on impeachment charges against him. During the 80-minute-long speech, he touched on topics such as the economy, defense budget, and immigration. Mr. Trump struck an optimistic tone as he focused on promises he kept, and also the economy. Of course, he's seeking re-election. And there were intense moments showing deep partisanship, to say the least. Take a look.
It was an extraordinary State of the Union address, one not probably seen before. It can be compared to a reality TV show with all of the high drama. Mr. Trump's address focused heavily on the economy, a central tenet of his re-election pitch.
Since my election, we have created 7 million new jobs, 5 million more than government experts projected during the previous administration. The unemployment rate is the lowest in over half a century. And very incredibly, the average unemployment rate under my administration is lower than any administration in the history of our country.
That was going down incredibly well with Republican senators, but on social media, there were a lot of people who were quick to fact-check the president. He also talked about defense spending. The U.S. president said he managed to convince allies to beef up security budgets, a pointed reference to NATO and the members' defense spending commitments.
We are also getting our allies, finally, to help pay their fair share.
Mr. Trump's speech was all about the portrayal of American renewal, with no mention of impeachment or investigations into his administration. Some said the address served a summary of his first 3 years as president, then a plan for the future. In a divisive election year, with little hope of a bipartisan legislative agenda, the political divide may just grow bitter and uglier.
Okay, the biggest takeaways from Trump's third State of the Union address. Let's loop in our panelists. Joining us in Iowa City, we have Timothy Hagel, professor of political science with the University of Iowa. In Chicago, we invited Laura Schwartz, political commentator who has worked at the White House during the Clinton years. And in Washington, D.C., Robert Moran, a partner with the Global Advisory Forum Brunswick Group. So I want to welcome to the three of you. Before we start anything, let's take a look at this moment which has been played and replayed on TV screens around the world. There were some dramatic moments during the President Trump's speech, which went viral on social media. House Speaker Nancy Pelosi appeared to be extending her hands to greet the president. Then he turned away. After that, when the president finished his speech, Mrs. Pelosi could be seen on camera ripping up the pages of Mr. Trump's speech.
Why did you rip the speech up, Madam Speaker?
But it was the courteous thing to do, considering the alternatives.
So, quite a moment. Actually, I didn't remember that much of what is being delivered in the State of the Union address, but rather the two dramatic moments. I guess the viewers around the world feel the same. So, Mr. Schwartz, is State of the Union address today and in the future going to be about content or drama only?
Well, in the Trump administration, it's absolutely all about the drama, because drama brings in ratings. Last night, we really saw the kickoff of the 2020 election campaign. Donald Trump gave some great red meat to his base supporters by not shaking Nancy Pelosi's hands. They loved it. And then Nancy Pelosi returned that gesture by tearing up the speech at the end, of which the base of the liberal left really, loved. And it definitely took away a lot of the steam of the actual speech itself. But it's tit for tat, and it's a sad day, honestly, that we have to talk about this the day after a State of the Union, which traditionally, given by presidents, is about the state of the country and where it will go, policies and different attributes of which can be implemented coming ahead. So while we are talking about this, and this is what is the thoughts of the day, it's too bad that we've strayed so far at this point from the reality of a strong union.
Mr. Moran, to you about also the latest situation. Do you think people are going to take a State of the Union seriously? After all, it's an important speech given by the president, and after all, both parties are likely to show their colors, during the State of the Union address and also after that. What do you think?
So look, I think the State of the Union is still a very important speech. As you pointed out, the president is really setting the tone for his reelection, which is a textbook case of a president running for reelection based on a very strong economy at his back and making that case to the American public. Look, I'm an analyst and a strategist, and I don't think we should over-focus on some of the drama here. I think that's largely a distraction. We know that the American political landscape is polarized at this moment in time, but it has been in the past. And I think the bigger questions on the table now are, how strong is the president running into re-election? His approval ratings are pretty good right now. And who is his opponent likely to be? And I think those are the two big questions on the table.
Those two questions need to be answered. If we could take a look at the latest Gallup poll, it could probably provide some hint. The Gallup poll released Tuesday morning. 49% approve of Mr. Trump's performance, while 50% disapprove, and 94% polled Republicans approve, while just 7% of Democrats feel the same, and that 87% point gap is the largest ever measured in Gallup polling. So I want to go to you, Professor Hagel. We understand the president now is enjoying an approval rating that is lower than his predecessors at the same time of the year, or at the same time when they are trying to seek re-election. How should we understand the current situation for the president, and how is that related to the content of this State of the Union address he chose?
Well, President Trump's ratings have always been very low. Part of that, of course, is because of the things that he's done has caused a lot of people to be very unhappy, and so, again, his ratings have been low all along. So the fact that they're creeping up now a little bit certainly bodes well for him, and a lot of people are suggesting as much. The economy is strong right now, although Democrats will try to poke holes in terms of this problem or that problem, but by and large, it's the economy that's going to be important for any president, really, that's running for re-election. That if you have a strong economy, it makes it very difficult to defeat an incumbent. Now, we've got a lot of time until the November election, so things could still happen, could have a downturn or a slowdown of some sort, or other problems that creep up. But right now, things look very good for the president.
Looking good, yes, indeed, especially if you look at the numbers, employment numbers and the growth numbers. However, Mr. Schwartz, since you are coming from the other party, it's likely that you have a very different answer, different interpretation. Tell me more about that. We also see the Democratic Party has already has their representative to speak against what is going on in the State of the Union address. But some say the issues are very dry, very dull, so not much attention will be paid to.
Well, it was really interesting last night, and just like the professor mentioned, the economy is good, the economy is strong. Say that, leave it there and move on. But the falsehoods that he had to enter into, you know, the wage growth, when adjusted for inflation, is no growth. The GDP has been slower than other presidents, including President Carter. So if he would just stick to the high points and the truths, he would be a lot better served in the next months leading up to the November election, because I think he created some really justified openings for whoever his challenger will be to go back and go into what he said and say, listen, you said this, but it's actually like this. And out on Main Street, people are asking about jobs and real wages for those jobs, as well as health care. Health care was something President Trump brought up last night and said that he would be protecting pre-existing conditions. Now, if you're a member of his base, you just take that in and you run with it. But if you're a Democrat or independent or independently minded, you say, well, listen, you're trying to strike down the Affordable Care Act as we speak and put an end to that. So they're really, I think, if you come from one area of the spectrum, yes, you're going to just love that speech. If you come from the other and use it strategically in a campaign, you can eventually take it and use it to your advantage by poking those holes and getting back to real people and the Main Street day-to-day look.
The Main Street is very interested not only in what's going on in the State of the Union address, Mr. Moran, but also what happened with the Iowa caucus not long ago. People are very confused. It seems that the parties, two of them, are being organized at this point at very different ways. Mr. Moran, your take about the Iowa caucus and the spillover effect about people's reactions towards State of the Union and the partisanship that is going on right now.
So look, I try not to get distracted by some of the things that I think the media is distracted with right now. So for example, the media is distracted right now with the counting of the votes and delegate selection in Iowa because of the new technology that was used in the Iowa caucuses. I think that's really
those are not
actually
important, but you know, those what's happening there really shows the organizational skills and the realities of one party, particularly in one of the most important states. A new app on the smartphone is wonderful, but certainly we have seen some interesting phenomenon there. Mr. Moran, people read something out of this.
Sure, but I mean, I think in the long run, and this is funny because I come out of Republican politics and I'm defending the Democrats here for a second. In reality, what's going on here is that the party decided to use an unproven new technology, a new app, and it didn't work so well. That happens in business all the time. To me, the bigger question is who's going to get the nomination. If you look at the polling data, the Democrats' strongest matchup against Trump is probably Biden, okay? And the Trump team would prefer probably Sanders as the matchup. Sanders and Buttigieg look like they're 1-2. We're still sorting that out in Iowa. Sanders is ahead in New Hampshire. We'll have to see how that plays out. But Biden has to start winning something here if he's going to get the nomination. If he doesn't get the nomination and Sanders wins, then that really helps Team Trump, because that's the matchup they want in swing states. It's important when we talk really quickly, when we talk about the president's approval numbers. Remember, it's a national election, but it's decided at the states. And so in reality, in a lot of these swing states, Trump is actually doing really well, and they want a matchup with Sanders because it gives them a capitalism versus socialism contrast. So Trump could still lose the popular vote but win in the Electoral College, and that's what's going on here, and they want the most favorable matchup. So to my mind, the issue is really not what happened in the Iowa caucus, but the internal dynamics within the Democratic Party and who that nominee will be.
Is that also your reading, Professor Hagel?
Yes, for the most part it is. That at this point, especially given the counting problems that we've had here in Iowa, the effect of the Iowa caucuses has been pretty much nullified at this point. We only have 71% of the results in, and at this point people have moved on to other issues. But what the Iowa caucuses really did was they gave people an opportunity to take, not just here in Iowa, but across the nation because of the media attention, to give people an idea as to what these candidates stand for. So yeah, at this point it looks like Biden is going to finish fourth here, and he did try a little bit towards the end in Iowa, but he hasn't really tried that much in New Hampshire. And if you finish fourth in Iowa, well down the pack in New Hampshire, it's going to be difficult for him to use South Carolina as his firewall. As was indicated, Biden has to be able to win somewhere if he's going to get the nomination and be essentially the establishment nominee.
Well, Professor Hagel, as you may know, the incumbent president certainly has an advantage over the other candidates in terms of international affairs. Now, we have seen this president already trying to lay his groundwork, whether that is about the phase one trade deal with China or, you know, the latest Middle East plans and things like that. But one has to say none of these did not finish without controversies. So, Professor Hagel, how much will this time in this election, when America First was originally the slogan of this president, likely to be influenced by international issues, whether it's trade or geopolitics?
By and large, not that much. That for the most part, and you kind of hit on it at the end of that question, where to the extent that foreign policy or particular foreign trade makes a difference, it's how it affects the individual voters, Main Street, as was indicated before.
Yeah.
And we see that here in Iowa with the agricultural industry, where that certainly whatever's going on with China in particular or other countries, Canada and Mexico and the USMCA deal, that yes, that's all foreign policy, foreign trade, but the question for Iowa farmers is how does it affect us, or producers and processors? And that's really the big issue. And now with those things signed, even though the road was a little bit bumpy to get those signatures or to get that agreement together, that now if it's starting to turn a profit or be good for the farmers, then it's a plus for the incumbent, in this case Donald Trump.
Yeah, Ms. Schwartz, your take?
Yeah, I think so too, but again, it depends on what happens in the next, 10 months. Will they see the turnaround that quickly from something like that? Because unless they see a turnaround in their pockets, just like Professor Moran was, or Professor Nagel was talking about, you have to see the impact on a local level. But the incumbent definitely has the upper hand when things like this are occurring within this time frame. But I have to say, the better that Trump does in the polls, I think that really is better for Joe Biden, because just like Mr. Moran was saying, Bernie Sanders, the socialist, the party is not crazy about having him being the standard bearer, but the more Trump improves his ratings, the more I think Democrats will wake up and say, listen, his chances against Biden are much better to lose than against a Bernie Sanders, where he might take it. So it'll be interesting to see how that plays out to Joe Biden's benefit.
Right. From now until the election, of course, this is not only the content of the State of the Union, but it's beyond State of the Union. Mr. Moran, a lot of things could happen given the frequency of big events and drama we have seen all over the world since the very beginning of this year. So, Mr. Moran, how should we look at the current level of discussion, if I could use that very polite word, inside your country going on right now? And how is it likely, do you think, some of the biggest events that you know already, or some of the barometers you know already, to influence the final result? Mr. Moran?
Right. In the United States, as Professor Hagel noted, most presidential elections, and in fact most elections, are decided by internal domestic discussions and how Americans are thinking about their local economy and the national economy. The United States and China are huge countries, and they tend to focus really on their own internal markets and issues. With all that said, there are a number of what people would call black swan events that could happen in the next 10 months or so, 9 months or so, that could impact the outcome. The biggest is if we get a global deceleration in the global economy, and if that impacted the United States, and how that could impact the the American economy and American workers. That would have the biggest impact on President Trump. But there's also questions around how other trade deals or the progress on those could impact the president. And then there are just other things that happen in the course of just time and how the president handles those events, which would go directly to his stewardship and leadership characteristics as judged in the voting booth.
I see.
And time will tell on those.
I guess time will tell. Thank you so much for now, though, the three of you helping us to understand the latest. Timothy Hagel, Laura Schwartz, and Robert Moran. Really appreciate it. Thank you. You're watching World Insight with me, Tian Wei. The program is coming to you live from Beijing. Coming up later in our program, we still have the second part of this exclusive interview with WHO representative to China about the latest coronavirus outbreak in this country and the global effort to fight against it. We'll be back after this. Welcome back. Let's go once again to the latest outbreak of coronavirus in China. We continue our conversation with Dr. Golden Galia, who is a WHO representative to this country. He's on board with the Chinese government's efforts to control the spread of the coronavirus, and he praised the medical community for their hard work since the outbreak. But he also reminds us to think twice about taking drastic decisions such as locking down cities and carrying out restrictions on people's daily lives. Let's listen in to my in-depth interview with him. This is your first day out of quarantine after your latest visit to Wuhan. So tell me more about this timeline, how WHO was informed, and how you've been checking on the information and the latest prevent and control situation.
The Wuhan government issued a notice, a public notice of the recognition of a outbreak of a cluster of atypical pneumonia at the end of last year. Specifically on the 31st of December. We were immediately alerted by that, entered into a rapid discussion with the National Health Commission, and shortly thereafter, on the 3rd of January, our own office met with the National Health Commission, and there was an international notice under the international health regulations. Since then, the progress has been on a number of lines. We have had regular meetings with the National Health Commission. So we have, as the National Health Commission has compiled the data and is able to provide a new milestone of understanding, we get that delivered to us, and we are able to spread it through WHO. Equally importantly is the laboratory side, where within days of the initial recognition of the cluster, the virus was identified, and by early January, there was the release of the genome sequence that identifies uniquely the virus and allows scientists around the world to start developing test kits.
I see.
Later, China has also released the probes and primers that are used by the technical specifications that allows other countries to be even faster in the development of the reagents they need in their laboratories.
Dr. Galia, many people are interested in knowing what about the human-to-human transmission. When does WHO know about that possibility, at least, with this latest outbreak, and how you've been coping with that, and how you've been cooperating with your Chinese side, or interacting, if I could use another word, about that?
In the very first cluster, it was either people who had an association with the Huanan seafood wholesale market, or contacts of those people, stallholders and workers inside the market. There were already a number of cases that were not associated with the market, and so the suspicion that some human-to-human transmission had taken place was happening very early. But then between that and sustained human-to-human transmission, it is a technical question that's very difficult to answer, and especially the investigation of clusters gives us some clusters of cases gives us some understanding that this might happen. It is only towards the end of January that evidence had accumulated, including by some examples of clusters of transmission that had happened outside the country. And that was one of the core elements that precipitated WHO to declare an emergency, a public health emergency of international concern.
I see. Dr. Gallia, when you say about the measures taken by Wuhan, because you were there in January, tell me about exactly Wuhan has been doing it, and how should we see the pros and the cons of the measures being taken so far?
My visit and my team's visit to Wuhan happened just before the controls about travel in and out of Wuhan happened. So even when we were there, we even saw how the airport was operating, its exit screening, and the operations of the airport and the train station. Lasting impression of Wuhan is of the dedication of the workers there. We visited Zhongnan Hospital, and in the 2 weeks before we visited, they had processed 2,000 people to identify out of them 13 confirmed cases. We must admire the dedication of the workers and respect the sacrifice of Wuhan and other cities that have gone into this sort of social distancing. We understand, as from the evidence point of view, that social distancing, reducing as much as possible the numbers of contacts between people, is an extremely promising way of controlling and breaking the transmission. It remains to be seen how effective that has. It is safe to say that this will, to a high degree of probability, have reduced the peak of the epidemic. It will mean that eventually the numbers that could have happened without such measures would have been far higher. Whenever you do a dramatic public health intervention such as this, one always has to balance the personal freedoms versus the public health imperative. When you do surveillance, you have to look into people's data to understand who they are and what type of disease. Normally, this is data that people hold confidential, but it must be shared between the workers in order to be able to analyze the patterns. People's freedom of movement, people's ability to function and work in society are curtailed. And so against that and the economic impacts that will result, one then balances the public health greater good. One of the things that we can see is that the actions taken in Wuhan and in China as a whole have been recognized by WHO as having contributed to the protection of global health. We are seeing cases outside China, but it is safe to say that without the measures that have been taken, both locally as well as nationally, we would have seen a much larger spread.
But what about, Dr. Gallia, you know, the people from Wuhan to the other part of China already. Now, there has been also very strict registration measures being taken, as well as various cities and localities in China looking for those people coming out of Wuhan. So what do you make of, once again, this balance that you just beautifully touched on?
One needs to understand that now it's important to not artificially label people, because that could lead to a sense of complacency. What do I mean? If one looked at this as a Wuhan problem or even a Hubei problem, then one could artificially relax one's attention. So not only is it important for us to practice solidarity and to avoid stigma, but it's not just because it's a nice thing to do, but because if we label the disease as being an issue of Hubei or of Wuhan, then we forget that now about 1/3 of the cases that are reported are outside Hubei. The issue is importantly to be seen as a China issue, and we should respect Wuhan and Hubei for the sacrifices they have made, but keep our vigilance up across the whole country.
WHO has vowed, as a result of announcing fake, to help those countries with weaker healthcare structures. One could think about the African continent, for example, or elsewhere in the world. Tell us about the latest efforts being made so far, how you've been coordinating, and what help have you provided, how to avoid the spread of the virus to these parts of the world.
We have immediately, the alert came to us. The same day, we had a 3-level incident management team set up with coordination between headquarters, the regional office in Manila, and ourselves in the country office. This 3-level team has continued to operate, and it's one of the most recent manifestations of that is the Director General himself, as well as the regional director of the Western Pacific region, coming to China to really represent a 3-level discussion about both what China is doing and what are the implications for the rest of the world. WHO has already on its website a very rich set of resources, has collected all the evidence from China, all the findings that are probable guidelines based on other coronaviruses such as SARS and MERS. This guidance is being updated on a daily basis as soon as new information. On the basis of a global effort, there's a mass mobilization of scientists and of public health experts to assist countries. Now that the public health emergency has been declared, all the country offices, like my own peers in other countries, are working with ministries to get their own readiness plans, how to strengthen their surveillance, how to prepare isolation units, how to achieve good supply of personal protection equipment, how to train their nurses, how to communicate the risk to their populations. So this is now happening on an international level.
Yeah. Dr. Galea, I know you are running out of the time for this interview. Final advice from you, final words as well for our audience watching our program today. Latest advice for them to protect themselves and their loved ones.
Thank you for giving me this chance. With every emerging infection, at its very beginning, there's no vaccine and there is no treatment. So we have to base ourselves on the behavioral response. Scrupulous hand hygiene, avoid handshaking, avoid the contact with surfaces that might be soiled. Food hygiene, respiratory etiquette, use your elbows to cover nose and mouth if you're coughing and sneezing. Social distancing, reduce the number of meetings that you have with people, whether avoidance of crowds, avoidance of physical meetings in offices. If one can reduce these numbers of contacts, we have a great chance of interrupting transmission. And finally, if you use masks, use them correctly. Do not reuse disposable masks. Do not fidget about the face because the mask itself can then become contaminated with your hands. And make sure that your surgical mask is disposed of after every use. Our control, our hopes of stopping the epidemic now lie very strongly in keeping social distance and observing personal behaviors.
Dr. Golden Galia, thank you so much for sharing your very precious time at this important time of a coronavirus outbreak in China. All the best to you and your team here in China. Dr. Golden Galia.
Thank you so much.
Thank you, sir. WHO representative to China. Bye for now, sir. Thank you. Really appreciate it.
Bye-bye.
That's my earlier interview with Dr. Golden Galia, WHO representative to China. And that is all the time we have for today. If you'd like to see more, try to find us. Our YouTube channel, CGTN World Insight, and also find us on Twitter and Facebook accounts. I'm Tian Wei on behalf of the team. Thanks for watching, and bye for now. Be healthy.